I'm not as young as I look, I promise. Okay. I know people always think I'm still in high school. I know. Okay. Okay. So, hi everyone, my name is Helen. I'm a mental health therapist. I've been practicing since 2021. And I just want to say thank you for everyone that's here. My mom's been a nurse for 45 years. My sister's a nurse at UCLA. So I hold a lot of really special things in my heart for the nursing program. So happy to be here. So what am I talking about today? Today I'm talking about the intersection of our immigration history and mental health. My family's from Loag City, Philippines, and my dad is from Holosolo. Is anyone here from Luzon or from Mindanao? Who's from Luzon? Okay.
We were just in Ilocos.
Wow. Yeah, my mom's from Loag City. Okay. Who's from Mindanao? No one? Okay. Usually, historically, people from Mindanao never leave the Philippines because of a lot of the family ties that are there. But I'm going to talk about that in the presentation. So, I want us to really be here in this present moment. So what I want to do is do a guided meditation for us to really be here right now. Because I know that all of us have worries, all of us have stressors. And so if you feel comfortable, close your eyes. And if you want to just ground both feet on the ground. Okay. And I'm just going to take us through this meditation. So breathing in really deep. I know that I'm breathing in. Breathing out, I know I'm breathing out. Breathing in, I notice my breath has become deeper. Breathing out, I notice that my out breath has become slower. Breathing in, I calm myself. Breathing out, I feel at ease. Breathing in, I smile. Breathing out, I release. I just want you to picture a release of whatever you're worrying about today. Just release it and just be here with us. Breathing in, I dwell in this present moment. And breathing out, I feel it's a wonderful moment. Feel free to open your eyes. How is that? Relaxing, right? Sometimes we don't know all of the worries that we carry throughout our day. And I'm just really excited for us to be here right now. Okay, so what can you expect from this presentation? So I know a lot of us are from Luzon, and so I want to connect our immigrant history and our mental health. I want to do a biopsychosocial examination, which is attached in the presentation below. I'm going to talk in depth about how Filipino immigration history has systemically impacted our day-to-day functions as Filipino Americans, how it's impacted the nursing associations, and then we're going to get into small groups of 3 and 4 and do a guided biopsychosocial examination. This is what therapists usually use to examine a person's mental health initially going in for a mental health treatment appointment. And then I'm going to answer any of your questions and do a question and response section. So, what's the lens at which I'm going to be discussing this topic? Professor Dr. Kimberly Williams from UCLA has a theory called intersectionality. Intersectionality analyzes how our systemic factors, how our isms, how our cultural dimensions, our relationships to people, and our personal history all have a confluence on who we become as people. And so I want you to come in with who you are as a person, not just as a nurse, not just as a mom or a grandma, but how are all of the experiences that you've had in your life become who you are today? So that's the lens at which I'm going to be talking about this. So there are multiple forms of expression, and my goal today as a therapist is that you understand more of the deeper roots of who you are and the history about how you got to where you are today. So part 1, Filipino American immigration history. So fun fact, who knew that the US and the Spanish-American War actually brought the Philippines together? Did anyone know that? You did? Yeah. Does anyone want to talk more about that? Not really?
I think the Spanish paid.
Yeah.
And the Spanish paid, the Americans paid the Spanish so they can go, and then Americans will come over.
Yes, and because the U.S. actually won the Spanish-American War, they acquired the Philippines, which was conquered by the Spaniards for about 400 to 500 years, right? And so, did you know, though, that because of the Spanish-American War, we have a strong relationship to the Navy, to the military. That's why a lot of men who are Filipinos actually join the U.S. Navy, join the U.S. military, join the Marines because of the strong military ties we have. And so prior to this, the Philippines was actually called the New Spain in the 16th century, the same amount of time that Mexico was also called the New Spain. Did you also know that the first Filipino settlement was actually in New Orleans?
Yes.
Yes. Okay, we have really great historians today. Who went to school in the Philippines? Everyone. So you all know about this. Awesome. So as you know, there's 4 waves of Filipino immigration history. There's New Spain. The Philippines becomes a U.S. territory in 1898. World War II, and Immigration Nationality Act of 1965. So the focus of my presentation today really centers around Wave 4, which has impacted all of y'all, which is the Immigration Nationality Act of 1965, which is the nursing shortage, the AIDS crisis, which caused a huge flood of Filipino Americans to come to the United States, and the miscegenation laws. Who knows what miscegenation means? Okay, so miscegenation, I'm going to be talking about this throughout the presentation, but prior to all of these acts before Wave 4, other Filipinos were actually put on quota. So no more than 200 Filipinos can come to the U.S. before the Immigration Act. And other Filipinos were not allowed to marry outside of their race. So that's why you saw a lot of loneliness, depression, and anxiety among Filipino Americans throughout before 1965 and even throughout 1965. So there's a systemic history of generational trauma throughout the Filipino populations. And I'm going to be defining all of this following the presentation. So most of the time when it comes to nursing history, this was actually a lot of women's ability to come to the US. So who came to the United States because they wanted to be a nurse in the United States? 1 hand, 2, 3, 4, everyone? Okay, does anyone feel comfortable sharing their history? Like, why here? Why not London? Why not Dubai? Why not the UK?
I was married to a Navy man.
Okay, I heard I was married to a Navy man.
Sailor, yeah, before I came.
Oh yeah,
That's why
nice.
I'm here.
Okay, really?
My only choice is to come here to be with them.
How old were you when you came here?
20 years old.
Wow.
I had my image.
Wow.
Just to finish my nursing school.
Okay, anyone else? Yes.
Every parent's dream is to have their daughter
Yes.
be a nurse, go to America, earn the dollar. That wasn't about nursing, that wasn't about education. I'm one of that.
It was about survival.
I happened to be in a very, very poor family. Being a nurse is not even a dream. Because it's beyond the concept of what
Yes.
I want. But I happen to have an education that's free that was offered. I want to be a teacher. So in my thought, if I'm a nurse, I'm in America, I can always teach. That's the thing. And so that's my history. None in my mind wants to be a nurse, but
It was the way out.
Transition.
I love that.
It's a land of opportunity, and
Yeah.
At the same time, I want to say Disneyland.
Yeah.
I
Disneyland.
want to see all the attractions in the U.S. And it's like a melting pot. You know, there's a lot of people here with different races and culture, and so it's a big opportunity for me to come over.
Wow.
I'm glad I did.
Yeah. My mother came here when she was 35, but before then she came to Dubai, and she talks about that nursing was a way out to a land of greener pastures. And so notice how when you're in a place of survival, there's a part of escapism that happens to our central nervous system. And so I'm going to talk about that, and I'm going to have us interact with the biopsychosocial exam. But I just want us to kind of sit in the story. that all of us have a story about how we got here, right? So I want to read this quote by Professor E.J.R. David from the University of Alaska. He says, Filipinos have one of the longest histories of immigration in the United States, dating back to 1587, when Filipino slaves aboard Spanish galleon ships landed in what was known as Morro Bay, California. Yes, I see everyone nodding their heads. Making Filipinos the first Asians on U.S. soil. I just want us to sit in that. Be proud of that. Yeah. Okay, so I want you to turn to the person next to you, and I just want you to talk about this for the next minute. It could be groups of 3, it could be groups of 2. How do the immigration events that I've listed thus far relate to your own experience? We've had a couple of participants, but I'd love for us to share stories for the next 2 minutes. Go ahead and share among yourselves. Okay, time. Does anyone still want more time? Oh, really?
Like long stories. That's okay.
I love that. Okay. You can keep talking, it's okay. I'll give, you sure? Okay, everybody. Settle back in, settle back in. Quiet coyotes. Okay. Who wants to share their story?
I'll do ours here.
Okay, please.
For me, actually, we, having spouses in the military, were affected by number 3 from that event, and as well as the nursing shortage, which is the immigration of the nurses.
Both, you were affected by both.
Yeah, right. Yeah.
Wow. The 3rd and 4th wave of immigration.
Yeah,
Wow.
once you become a nurse in the Philippines, that's almost like a ultimate goal of every nurses. Actually, when you get interviewed to become a nurse, you know, and to learn how to become a student nurse, you do not want to answer, I want to go to America, because that would not.
Really?
Yeah, you cannot say that.
Really?
I want
So,
to use
as a
it-
student nurse, you can't say you want to go to
No,
the
you
United
don't want
States?
to, yeah.
Why not?
Because it's automatically they will think that you're really not there to become a nurse. You want to
Really?
just- your ultimate goal is to be abroad. So I guess it's my fault. That's why we were taught to not answer.
Wow. Okay. You want to share?
Yeah, my name is Chris.
Hi, Chris.
And I was already a staff nurse in the Philippines before I came over. But I thought of coming over, you know, as a working nurse.
Mm.
But my husband, who was in the Navy then, married me first. And the choice but to come over
Wow.
as a spouse with my child.
Wow.
So it took me like about 3 years maybe, or I mean to start getting into an exam. So I started as a CNA, which I worked in a nursing home, and I got ripped, you know, with my uniform because my patients were so big and I was so tiny. And I told my husband, I said, I better go and, you know, I better go back to the Philippines because we had nursing aides, you know? So I was crying every time, and then I took the LVN, and then eventually became an RN.
Wow.
So that's my
Wow. Yeah. So my mom was, like I said, my mom was a nurse in Dubai, met my dad, had me, and then secretly applied to come to the United States. She was a CNA, and my dad was without a job for 6 months, so nursing was a way of survival for us. It was the only way that we could actually live off of her having 2 children. So I just want us to notice the theme that we're talking about today, where this is not just a career. This is a way to live, to foster understanding of yourself, a way to have a living and income. So I just want us to see that this theme that we're noticing today in this room, nursing is deeper in the Filipino culture than what other people talk about when they talk about who they want to become. And so it's why my parents would always say, why do you always talk about your passion? It doesn't make sense to me why you talk about your passion. Try to make a living, right? But if without the understanding of how systemically all of these events in immigration have affected us, we can't understand why we say that to each other, which leads to dramatic shifts in family where children are resentful of their parents. They don't understand why their parents are pushing on them. But without this, we wouldn't be where we are right now, right? Okay. So I was going to ask if anyone felt comfortable, but all of you are very comfortable. So I'm going to skip now. Okay. Another statistic for you by the CDC in 2013, 45.6% of Filipino American adolescents have suicidal ideation, the highest rate among all ethnic groups. So why is it that as older generations, the suicide rates are lower, but as adolescents, the suicide rates are higher? The reason for that is there's a lack of understanding among cultures. Filipino American culture is very different from Filipino culture. Filipino culture is about survival and getting out of poverty. Filipino American culture is about understanding what your passion is, how to follow your parents, but also make yourself happy. So I'm going to talk about the dissension between our current generation and our past generations and how they affect us today. 1 in 20 nurses are Filipino. You already knew that, right?
Yeah.
Yeah.
Just go on a night shift and just go to the hospital. Just go to one hospital.
Yes. Yep. So another interactive question for you. We've talked about survival, but what other values were driving your families or are driving your family?
Togetherness.
Togetherness. Okay. Okay. Togetherness. Anything else? Food.
Cultural foods.
Food. You said reliability.
Reliability, because I know our children knows as Filipinos, we know how we love our children. So no matter what happens to them, we are there to support them.
I love that. I love that.
Unconditional love.
Unconditional love, togetherness, reliability. So, how does our immigrant history affect our mindsets? Let's just talk about that. This picture that I have here is actually one of the first Filipino students to ever study in the United States. They studied at Columbia University. Yeah, right? So what do we know so far? Quotas, war, colonialism, anti-marriage laws. I'm assuming financial stress on you to make money, anxiety or depression in pregnant moms, which associates to how you give birth. So I want us to think about the statistic of why 45.6% of Filipinos in the current generation have suicidal ideation. Think about all of the things all of you had to go through in order to get here to this country, the amount of stress you had to go through to immigrate. That affects your pregnancy, which affects a child's ability to process trauma, and they're more anxious out of survival. So this leads to what's called unprocessed intergenerational trauma, where there's a lack of understanding in the older generation and a misunderstanding in the current generation, which creates family division despite the family value being togetherness. Does anyone have a theory about why that's the case?
Culturally, it's different to live here
Yeah.
versus the one to grow up and be raised in the Philippines. In the Philippines, we really respect our elders. We cannot answer back. Whereas here, as a parent, we don't expect the same thing for our children. But yet, when they go out of the house, then they have to adapt to the culture of the Americans where children are much more open. And so that thing that creates confusion for them. Like having a boyfriend early, that's not allowed in the Philippines. I mean, no, you can't go out in the Philippines unless the parents meet the guy, and the guy's been going to your house forever and ever. And then you say, yes, you can be my boyfriend. Whereas my children, my daughter who grew up, has to have had a boyfriend. It's a good thing that we're so liberal. What we ask for her is to just make sure that before you go out, we need to meet the guy.
Yeah.
But we don't restrict her.
Yeah.
Actually, our house is the hub of all the Filipino kids.
Wow,
When
really?
she was growing up.
Wow.
And she said that my friends like coming here because you're more open compared to their parents. And that I was surprised. Because I grew up having parents also. My father is very open and
Yes.
not strict.
Yes.
It's not strict like my mother's parents
Yeah.
and my mom. So
Ligawan.
I think that's the reason why. I don't know if that's true. But
Yeah, my first boyfriend, my parents wanted to meet him before he could ever date me.
yeah.
My mom said
It's
it's,
a rule.
yeah, she said it's not, I don't understand American culture. You can just date whoever you want and you don't meet the family. That's not a respectful way of
Correct. Yeah.
marrying somebody,
Yeah.
right?
You cannot meet any friend of yours in the mall.
Yes.
Bring her over here or him, and
Yep.
we have curfew 11 o'clock. You're not on your way home. I'll be calling all
Yes.
the parents. So you
Yes. Yeah, my mom always says courting instead of dating, right? Are you courting? Is he courting you?
I can remember one comment from my daughter in the same incident that she said, Mom, with the curfew, at night, past 11 o'clock, I'm waiting, I'm calling.
Right.
So when she comes up, she goes, Mom, why are you looking for me? How come my friends, I never hear their parents call them, you're
Yeah.
waiting for me.
It's very different.
Yeah.
So there's a big difference
Yes.
in their
Huge
upbringing.
cultural difference.
They feel that.
Yeah.
That's why
Gonna
it
go back.
becomes our problem, teachers at school,
Really?
because the students are always asking, Gina, can you explain that to my mom? Dad, I am not born in the Philippines. I'm a
Right,
Filipino American. I'm
Mm.
not Filipino. And I understand a Filipino culture, but I am also an American.
Yeah.
So there's a confusion, I guess.
Yeah. I'm sure that it's broken a couple of parents' hearts to know that, right? And tension it's created.
The first guy who came to our house, my husband was short of asking for his social security number.
Wow. That sounds like my dad. Okay. So, how does intergenerational trauma look like day to day? Looks like this.
Yeah.
Chronic stress, irritability, generalized negative self-talk. I hate my body. I hate how I look. I hate how I have a big nose. Poor self-image, social isolation. They don't want to hang out with friends. They don't feel good enough. They have identity crises. Their family values crash, like we just talked about right now. There's worry about the future. How am I going to make money? Is nursing the only option for me? I only can become a doctor? Those are usually the discussions that happen in Filipino American families. Angry outbursts. Some children who have intergenerational trauma also have a really difficult time sleeping. Sleep is a really, really big issue, which creates psychotic episodes, which creates higher likelihood of developing depression and anxiety. Hard to stay present and relaxed. You'll probably see a kid get agitated, bang tables. Low self-esteem, self-harm is really big among Filipino Americans. Mental health has only been reintegrated into the hospital system in the Philippines in the last 10 years, which is, it's wild to think that therapy is fairly new in the Philippines. Increased depression and anxiety, and low self-esteem. So there's a difference between a poor self-image and a low self-esteem. You can see yourself poorly, but you can still have the esteem to go up to someone and talk to them. One is not different from the other, but a low self-esteem usually results in your inability to strive for something more, to have energy, to be able to talk to people. So personally, as a 1.5 gen, as they like to say, when I immigrated here when I was 6 years old, I experienced all of the depressive symptoms because I grew up in the Philippines for the first 6 years of my life, And then when I came here, I was forced to integrate into American culture, which made me feel isolated, and I developed a lot of these signs of self-harm, isolation, poor self-image, poor self-esteem. So mental health, I can say why I entered into the profession is because it worked on me. I am a byproduct of someone that's healed their intergenerational traumas. And so this is not a diagnosis. These are just symptoms that will eventually go away with proper mental health treatment. So I just want to be clear about that. So, why do these symptoms that I just talked about affect us? Similar to everything that we've been talking about, the historical events that I've listed out create racial oppression, colonization, feeling othered in a room, feeling like you're not good enough if you're tall, white, and beautiful, history of cultural denigration. So, who has heard of Jokoy? Everyone, right? He always has a joke about nurses, right? So what do I mean by cultural denigration? Being a nurse as a Filipina has become a joke, right? It's become a stigma. And so when you say to someone you're a nurse, there's usually a joke after that, or there's an insult after that, or there's a joke reference after that.
They thought they're all blonde, especially the blonde nurses. I mean, it's not just us.
Yes.
It's also the American nurses that are blonde.
Yeah.
Sexy. Their own.
And married
Yeah.
to a sailor.
Yeah, you get that too? Really? Mm.
That's why the RN reserved for nurse.
Really?
Reserved for the Navy. Reserved for the Navy.
For the Navy.
Wow.
Mayaman yan, nurse yan.
Yeah.
Oh, if she's rich, she's a nurse. Yeah.
That's why if you see a Navy man, the wife is either a nurse or a teacher.
Mm.
But yeah, so that's always the case.
Yeah.
So if you meet, oh, your dad is a Navy, yeah, I bet your mom is a nurse.
Really? Wow.
That's
Wow. So I also want to list these other two things here. Separation from your familia. I'm sure there are people here that miss family, that wish they could be there with them, but feel like they had to make the decision to come here.
Yeah.
Yeah. Intergenerational trauma, history of suicide in the family, history of depression in the family, history of self-harm in the family, history of suicide in the family, as I said before already. History of maybe children not even talking to you, you know? And that's painful. I'm sure some of us have felt that. So, what does this look like for you, the participant, day to day? Turn to your partner, to your left or right. I want you to interact again. And talk about this amongst yourselves, whatever you feel comfortable talking about. What patterns did you notice in your family or friends of family growing up?
It doesn't matter.
Yeah. It's time. That's the thing about Filipinos. We love to talk, huh? Yeah. Okay. Does anyone feel comfortable sharing what you shared? Okay, 1, 2, 3, 4. Let's do one. Mm-hmm.
Can I share?
Yes.
Okay. This is what I shared. How I become her. I believe in the Philippines, my mother is from the poorest of the poor. They're farmers and all that. This rich, full of vice. They're alcoholic, babaeros,
Yeah.
no value, I should say. I'm sorry, this is a family. On the mother's side, they're all meek, they're all hardworking, they value the money, they talk, the relationship is close. My relationship with my cousin on this side are deeper than these people. But at the end, this didn't do much. These are very successful civil engineers and all that because they value how they will reach. And this affected, I think, the personality of the person that brought up. That as children, I have a very aggressive in me. I am very insecure in one side of me, and I think that affects all of this. And the survival will be on the person. Like, I grew up with a very alcoholic father, and my dream is, I want to get out of here. On the other side, another sibling would just say, oh, he was an alcoholic, I'll become an alcoholic. So, support system, your strong drive, your vision, all counts.
Yeah.
It's all about me at the end.
That's good.
I'm enough.
Yes. I love the theme of individual choice, where you had a choice.
Yes.
I love that.
There's a lot of choice also. Because this rich family didn't want this poor lady.
Yeah.
My parents eloped at age 17.
Wow.
At age 17.
Wow.
My father see that there is a future in this that they have. I want everything that I have. They eloped, went to Manila. But my mother, he was only 4th grade, desired to have higher education. So he pushed my father to go to college. So he became a mechanical engineer. She's a 4th grade. But for a 4th grader, because of this dream and deep desire, she took the U.S. citizenship test once. Because I think deeper, she's smart, but it wasn't brought up.
Wow.
You first study this, you need this to take the test. She was perfect in front of this U.S.
Wow.
My neighbor, who is principal, blah, 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 took the U.S. test 4 times, failing.
Wow.
So that's the comparison of what you really want. You will get. Yes.
Everyone give a round of applause. So good. Anyone else feel comfortable? Who's number 2?
Sorry, I'm supposed to be number 2.
Number 2.
I won't share anymore.
No, I'm so involved with what Pearlie said. That's what I have to say.
Do you want us to come back to you,
No,
Marla?
that's okay.
Okay.
So with me, I still have that kind of hardship when I came here to the U.S. because
Yeah.
I was so fortunate that my parents were here and my siblings. But my issue at the time, my oldest sister wanted to stay with her in Gap. We had
Wow.
to stay out of her house. I told her we can live together. We gotta be happy together. It's so important for us, the Filipino family. We always spending time together, right? Getting along together. So I said it's better for me, I think, to get out of the house, of her house, and they just stay in an apartment. And since then we get along well. They're being far from each other.
Yeah.
I mean, sometimes she still has that behavior, but it's okay. But I think what's important that I really notice in the family, Filipino American family, that we expect to be well educated. Yeah, it's really, really important. I think that's why it's hard for us if we can see that our children will not follow that kind of path. Okay, to be this, but they have different choice in their lives.
Yes.
Now I think we are more open.
Yeah. Education, military, and nursing were one of the first professions open for us. So, does anyone know why all of you are from Luzon that came here to the United States? Historically, why?
Olongapo. the military base in the
I'm from
Philippines.
Olongapo.
Yes.
Selling
But,
point in
I think
Cavite.
Yeah.
the geographical location.
Everything is about land. So the base of the military was in northern Philippines, which is where all of you are from. Military, going to the United States, connections were easy. So northern Philippines is actually where most people choose to immigrate from. So my dad is from the southern, he's from Mindanao, he's from Holosolo. There's no police there. It's run by mostly Islamic peoples, and there's hardly any American influence there. And so he didn't want to immigrate. So it's coming back to our stories as Filipinos. Our stories come from here. They come from our mental health, right? Okay, I don't want to forget. Number 3?
I think I was.
Yes.
So the patterns that the four of us thought were, that we value really is education. All of us grew up with our parents telling us, you have to finish school so that you can have a better life. You can immigrate to the U.S. and have a better life. And I think that's in our minds. So even if we are now in America, that's something that we continue to tell our kids. Education, value education.
Yeah.
And I think just we value education
Yes.
a lot.
Yeah.
My parents, I remember my parents telling, okay, just be educated, finish your degree, and then you can get married, right?
Yes.
Because we want them to have a better life than what we have.
Yeah.
You know, and then we discussed something about our generation, we're the boomer generation.
Yes.
You mentioned earlier that the adult Filipino Americans didn't have a whole lot of the suicidal ideation.
No.
I was 21 when I got separated and had to go abroad
Mhm.
in a different country, in a different language. And I was so homesick. But in the back of my mind, I had no time to be homesick. I
Yes.
had to earn the money so I can send that money back to the
There was
Philippines
purpose.
to help my parents.
Mhm.
This is a pattern, I
Mhm.
think, for all of us as well. So I didn't have time to be suicidal.
Yeah.
I have to earn, I have to learn the language.
Yeah.
I have to survive,
Yeah.
and that way I can help them.
Yeah. Suicide, one of the assessments that I do for clients is, do you have a reason to live? And all of you had a reason to live,
Right.
right? And so what happens when you work really hard, you have children, and your children have everything, and they don't have to work towards anything anymore? What are they living for, right? So it explains why the suicide rates are so high among Filipinos, because you're telling them the narrative of get a good education, you have to make enough money, I don't want you to be homeless, but they didn't have to work for that. They didn't see homeless, they didn't see poverty, they didn't go without food.
So our dream of them having a better life than we do, in some way, if we gave them something.
You did.
Their weaknesses.
Yes, it gave way.
Right.
Yeah.
Yes,
We became
because of adversity.
correct.
And so,
And then with them, it's the opposite. So
Yeah.
what we learned as our strength became their weakness.
yes.
And that's
And that's why, when I do these workshops, I always like to encourage people, give your child hard things to do. Let them do hard things. That's what builds grit. That's what builds honor. That's what builds strength in your inner being, because you went through that. So don't take that away from them, right?
Yeah.
Yes. Number 4. Hi, Pat.
And then 3 more daughters were born in San Diego.
Wow.
So my Manang Jean in high school, she went to a Catholic all-girls school and had met a boyfriend who went to the all-boys school, St. Augustine, here in San Diego. But he was black.
Mm.
And so my parents are very Catholic, they're very open, but they fell to the pressure of family,
Wow.
relatives.
Wow.
Looked
Yeah,
down
I can see
back
that.
in the late 60s, black is not what you want your children to date.
Wow.
So anyway, they sent her to the Philippines after high school.
Really?
Yes, so she was there for 2 years, didn't work out, she came back, and her boyfriend got married.
Wow.
So they disowned the couple,
Really?
and James. But when she became pregnant,
Yeah, they start.
their heart opens, their arm is open, sorry, we did this to you, you have our first grandchild. So everything was amended, everything was great.
Mm.
And Tanya was born. So, but James died in an accident, and they just felt so bad that they had limited time to know him. And when they did get to know him, he's a wonderful man.
Yeah.
And so they said, no more. Whatever our children bring home, we're okay.
Yeah.
We're open.
Wow.
You know, they're nice.
So similar.
Sister Jackie, she brings home a black man. Douglas, who's wonderful. And they were all accepted. It was like they lived and learned from the first
Wow.
time. And then I bring home a Filipino. And my dad goes, what's wrong with you? Coming here and assimilating and you know, the melting pot of San Diego, they just,
Yeah.
and they're, you know, it's their Catholic upbringing of everybody in our family. And
Yeah.
and over time, the relatives, they're all mixed up, all their children, all.
Love it.
So, you know, but it was a learning thing for my sister. I
Yeah.
mean, for everybody.
Yeah.
Relationships with other cultures.
Yes.
That's the best.
Yeah. Yeah. Okay. Thank you for everyone's participation. This is so fun. Okay. So we already did some real life stories here. We can move straight to the biopsychosocial. I have 2 case examples of how it affects younger populations. Do you want to hear that? Yes. Okay. So the LA Times released a series on Filipino American health. My friend Agnes actually helped write the series. And she actually wrote about Daniela Pila. She's a postdoc student. And she actually has a story of her getting made fun of as a child for having a big nose and a fat face. So she would scrub her face with papaya soap to become white because she didn't want to be brown. So I tell this story because she's doing really well now. She's getting her PhD. She's very accepting of her skin color, but there's a history of self-hatred that usually happens for people who grow up in the United States. Especially, she actually grew up in an all-white town. So it's really hard. And colorism also exists in the Philippines, as everyone here knows, where the more white you are, the better you are. Yeah. There's whitening soap. And so, I don't know. There's colonialism has, yeah. Colonialism has bled into the Philippines. So, yeah, there's mestiza and then there's morena. Yeah.
That's why there's a lot of advertising of whitening.
Yes.
Whitening the fair.
Really? Has anyone struggled with that? No?
I was always called,
Mestiza?
I was very morena.
Yeah.
You can see my pictures from my classmates, and I'm like so dark. Because I like going to the river. So I'm
Yeah.
so dark.
Yeah. I'm a morena, so I like it. Okay. Another quote from E.J. David. He actually specializes in Filipino American history, if you want to look him up. I got to meet him. He's written a ton of really great books. He says, in the community's widespread preference for lighter skin, feelings of inferiority, shame for being Filipino, and discrimination against Filipinos perceived as not westernized enough. So this quote doesn't just have to do with the fact that Filipinos feel like the less white they are, the less valued they are. There's actually a history of Filipinos getting westernized in the early 20th century, where my actually great uncle was part of this program, where they took him to the University of Washington, and they gave him a college education so he could learn the American way.
Oh, wow.
Yeah, they used to do that to Native Americans. I see people nodding their heads here. Did anyone's relative do that? No? Okay. I did
when our kids were growing up in Florida, and they started school, we were called to the office and they were asking us what was the main language that we talked about.
Really?
And so we said, it's Filipino. They discouraged us just because, they were all speaking English. But the kids were speaking English. They didn't have any accent or anything like that. But they discouraged us and told us to talk to them in English.
In English. Yes, I remember that. The district office.
But we came to California and, you get hired right away if you were bilingual.
Really?
Just because Mexican and English,
Yeah, I
the
never-
Spanish and English.
Yeah.
Yeah, I remember that the principal then were writing us not to speak or lessen our speaking with
Really?
kids in.
It's
all
changed now, yeah.
They even want injection, whatever that injection is.
Really?
Yeah, glutathione. They were suggesting that you take a shot of glutathione, whatever that is, to make you a little cry.
For your liver. I know, right? That's how it's metabolized in your liver, so I don't advise using it.
So I said, no, yeah, they suggested I should go to have a shot of that medication.
California is restricting prescriptions for those too. So not many.
Yeah. And speaking with the how do you call it, westernization,
Mm.
because I have an uncle. Oh, he passed. I had an uncle who is very westernized, and he claims himself as this is how we were taught here when we came here, because he is actually we just call him uncle, but he's a lolo. He's from Ilocos, and then he got recruited to the Navy. They were just in the by the beach playing, and here comes the ship of the American sailing ship, and then they got them. He was just like 16, and then after that, the Lolas, the mom just got a letter, or the parents just got a letter that they were drafted. They were drafted to the Navy.
No notice, no going.
No.
Wow.
That was just like that. And then, that was I remember with the story of my uncle. And then.
Was this World War II?
Yes.
The Pacific
Yes.
side?
Yeah.
Wow.
That's why we have the Phil Vet Rep program.
Yeah, yeah.
Yeah, that's
That was the way that Filipinos during World War II, before the Immigration Act of 1965, became citizens.
Yeah.
If you served in the Navy.
Yeah.
Oh, I don't know. I've never heard of that story. Yeah.
That's how they drafted. They were drafted. And then this son, he said, this is how it should be. And then whenever we go to his house, you should only speak English.
Really?
And then you will be, because he was saying then because if you speak English, the better job that you're going to have.
Oh.
But that's why I think when he knew that I was talking to my children in Filipino, or in Ilocano, they said, you should not be talking to your kids like that. You should be talking to your kids in English.
Oh.
And my major is English.
Wow.
I said no.
Yeah.
But that's how they
I went to put Tagalog as my second language, and it wasn't counted as valid because most Filipinos know how to speak English.
Right.
Yeah.
So, yeah, it's no longer an asset to know
That's
Tagalog.
why it has become Filipino as the national language, no longer Tagalog. It's
Mm.
Filipino.
Wow.
Because our alphabet now is no longer abacada. It's
Mm.
changed. It's already 28. Because we already have added F,
Wow.
N, Enye, Z, V. So if you say computer, you will just change C to K.
Wow.
And then the P-U, P-Y-U.
Mm-hmm.
And then computer. That's just how it is.
Yeah.
There's the accent. And then the
Wow.
So that's Filipino.
Yeah. There's a theory among sociologists that Tagalog will probably be no longer because English is more encouraged now. So,
Not in the Philippines, though.
not in the Philippines.
A medium of instruction in the Philippines is English. Now, not anymore. It's pure Tagalog.
Really? Good, good, good. Yeah.
In college, sometimes you would hear the professor talking in
Yeah.
Taglish.
Yes, Taglish. Ilocano is now a major.
Taglish, now it's Filipino. So it's Tagalog is for the region, the dialect, the vernacular, but for the diaspora, it's Filipino.
Mm.
So
Wow.
when you say, yeah, there's an F, it's an F.
Wow.
Filipino is the language.
Hold on, I see two hands. So you first and then you second. Yeah.
I remember when I was in the elementary grades, late 50s and early 60s, when we were, like talking with our classmates and all that, we were encouraged actually to speak in English.
Right.
And you would get fined,
Right.
like
Yeah.
25 cents,
Yeah. Right.
If
Yeah,
you speak,
I remember that.
you know,
Wow.
Tagalog.
I got fined too. I took English. I was really bad at English
Yeah.
when I was first
in
grade.
high school.
Yeah, grade 1.
Yes, that was the time when the medium of instruction in the school is in English.
Yes.
So you have to study English, Filipino, and Spanish.
Wow. Yes, my dad told me about that.
Yeah, Spanish.
Spanish.
Alex level. Yeah.
You second and then third. Yeah. Okay. So the last part of my presentation before we head into the biopsychosocial exam is giving you the tools that you can take notes on. It should be, the PowerPoint should be in the folders that you received. We're going to go through one more case study, and then I'm going to give you one tool to help calm any anxieties that you might have in the present moment. It's an acronym I like to call DARE. So feel free to take out your pens, and then after we do the biopsychosocial exam for 30 minutes, then we're going to go to some question and response. You can ask me any question you have. So, okay. Oh, I'll go over it later. Yeah. Okay, so last case study. This is going back to the younger generation and how Filipino American immigration affects younger populations. This is actually Amelia Katakutan from the University of Wisconsin. She actually quit her job during the COVID-19 pandemic because some of her family got COVID, some of her relatives are nurses, and so it caused her a lot of grief and anxiety to be able to have family in the front lines. And so I don't know if any of you served during the COVID-19 pandemic in the front lines, but it really does affect the children too, like it's affected us as a collective. So in summary, we have an awareness of how our history affects our personal lives. We have an idea of how the systemic affects our personal lives. And we also know that a lot of the things that we learned didn't start with us, but what do we do about it? Okay? I just asked that question. Okay, so here's the acronym that I always like to give clients. It's called DARE. DARE stands for diffusion, acceptance, run towards, and engagement. So a lot of people, when they feel anxious, feel like they have to run away from what makes them anxious, but I ask you to, I almost reframe it in your mind, to run towards the anxiety and change the perception that you have around being nervous about it, but being excited about it. And I'm going to go over it in the next few slides. So what does diffusion mean? So whenever you're anxious about something, the first thing that usually comes up for us is, what if this happens? What if I lose my job? What if my kids don't graduate from college? What if my kid doesn't want to do something? What if someone drops out of school? I want you to instead think, okay, that happens. So what? Does anyone want to role play with me?
Sure.
Okay. What's something that you're worried about right now?
Oh, our 50th anniversary.
Okay. Worst case scenario, what are the what ifs that are coming up for you?
What are the what?
What are the what ifs? Like, what if this happens?
What if we do not meet our budget?
Okay, you don't meet your budget, then what?
Then we will lose a lot of money with our PNSD cover,
And then what?
and then I will be blamed.
And then you'll get blamed. Please don't joke about that. Notice how diffusing the situation is running towards the situation. It's being able to say, okay, what if my worst nightmares come to life? So what? And then what? And then what? So usually these questions are a positive way of using our anxiety. Now I want you to think of anxiety as not a bad thing. It's been used as a really bad stigmatized word, but anxiety is actually a good thing. Our families wouldn't survive if we weren't anxious. If a running train were going by, we wouldn't be able to jump out of the train tracks unless we knew that it was going by. So DARE is diffusion. It's being able to say, okay, so what?
That's my favorite word now.
Yes.
I just used that diffusion when I was talking to Rudy a while ago.
Oh yeah? Nice. So next, accept and allow. Allow the anxiety to happen. You know, I don't know if any of you have dogs, but do any of your dogs shake? Shag? That's actually the dog completing what's called the stress cycle in an animal's body, in primates' bodies. So when you allow the anxiety to come through you, you feel the feelings all the way and you complete the stress cycle. So what would it look like for you to just sit with the anxiety? I wrote something here. An easy way is to repeat to yourself, I accept and allow this anxious feeling. It goes back to the adversity topic that we were discussing today. Life is not without hardship. Life is not without tragedy. And so how can I allow myself to feel these feelings all the way and be in acceptance of those emotions? Who has an idea of how this looks like in your day-to-day life?
It's kind of hard if, like, you're anxious to talk in public. You get all those tachycardia. How are you going to say, I accept getting very nervous in front of the public? I have this anxious feeling. You keep saying that to yourself and it will go away.
It will.
Really?
Because life is not black or white. When you get married, you're nervous, you're anxious, you're happy, you're excited. Life is full of emotions. And so when you deny yourself an emotion, you're denying yourself the full experience. So it's being able to say, how can I just allow myself to be nervous right now? Nervous can be reframed as excitement. Shy can be reframed as a really great listener. You know, maybe you're just excited to be here when you're speaking up in stage. And so that's why your body is coursing through with adrenaline. Life is not happy or sad, it's everything. Right?
Because because of the nervousness, you get chest pain, and then you get.
Let it happen.
all this.
Let it happen.
Give you medication, man.
Yes.
Okay, if you feel anxiety, like for me, if I feel that anxious, then I would just think like, oh, this is just temporary, it's gonna go away.
It will, everything
So I have to
passes.
put that in my mindset.
Everything passes. That's you completing the stress. So you're not allowing the stress to persist.
I think it makes
Yes.
sense now. You gave me an answer to that because like there was a job before because since I enrolled in one of my masters is speech drama and theater arts. So madrama ako, I would say. So when I was in one of my jobs then, my boss was so poker faced. He's Italian, German, American. And then, because I was just a part-time then, there was this rumor that was around, and they said all the part-times will be fired. So I went up to him and I said, I am so scared, and scared word was not supposed to be said.
Yeah.
I'm so scared of you because you don't smile. But I'd like to ask if you're going to fire me because I will not accept that because I'm doing my job.
There's so many different emotions in that statement.
And then he said, I'm not firing you. And that made me ridiculous.
Yeah, I like that. I like that. So you said it out loud, you allowed it to happen. So in today's presentation, I was nervous, and I'm not nervous anymore. I actually didn't get any sleep last night because I was so anxious. But I reframed it in my mind. I said, okay, I accept that I'm anxious. I accept that I probably didn't get any sleep last night. But I allowed that to happen because I'm excited to be here. Right? So there's so many different things that happen to us every single day. And when you deprive yourself of the feeling of sadness or grief, you actually remove what life can offer you. Because feelings are just signals. They're just telling you what the situation is presenting you in that moment. But it can go away. You just need to allow it to be. There's no fixing. It's just letting it happen. Okay, next we run toward the anxiety. I'm nervous, so I run toward the presentation. I am scared that I'm not going to meet the quota for my budget, so I'm going to what?
Do fundraising.
Do fundraising. I run toward it.
And I will beg the treasurer and them out to lunch.
Okay, so you run toward the anxiety. I'm excited about this feeling, you start to say to yourself. I'm excited that I'm anxious because it means I care. I'm excited that I'm sad because it means I love this person. Right? Any other examples people have about running towards something? Yes. Yes, there's positive, negative, and then there's both in an experience. Okay. Any questions about this before I move on? Okay. Let's move on to E. I engage with what I'm afraid of. So what does engagement look like? It's fully engaging in an activity so that you can remove yourself from being so hyperfixated on the emotion. So rather than me fixating on the fact that I was nervous, I focused on the content, right? I focused on all of you and getting to meet everybody. So when it comes to the budget, what can you focus on?
The celebration, the event.
There you go.
Happiness.
The opportunity to serve, maybe?
Yeah.
Love that.
Community.
Love that. Okay.
Now you're not answering. So do you guys agree with the budget?
Okay.
It's just an experience, and it says engage. We just did their methodology. It says reading. Really, I did the research, I interviewed people. Really, that fear of not making it happen, not delivering, drove me to do research.
Yes.
This, so that's one. And then doing with mindfulness. We continue to fundraise because this is something that we need to do. And then completing it, the task, like don't stop, don't freeze because of all the other.
If you want to remember this in just one question, what's within my control?
Yes.
I can't control everything. I can control who gives the money and what time, but I can control me and how I respond to this.
Right.
So I diffuse, I accept and allow, I run toward, and I what?
Engage.
That's right. Don't miss the last part, engage.
But you also include praying.
Yeah, you pray too.
Prayer is really healthy. That's actually in the...
Isn't that a form of
It's a form of
meditation?
Yes, it is. Yes, it is. It's actually in the survey that you're about to do with each other, the biopsychosocial examination. Spirituality is part of that. And so they found that people who are spiritual or are part of a religious practice actually tend to have less anxiety, have less depression. So, any other?
When you complete a task from what you have already, you always have to have a plan B, plan C, so you won't get more frustrated.
Yes. That's in your control. Love it. Okay.
You have control over your happiness.
You do. You can control what you focus on. So now that we have a tool to calm our nerves, we're going to do a biopsychosocial examination. And so I'm going to go over what this is, but the goal of this exam is to increase your mental health knowledge, apply everything that you've learned today, and really be with one another. So a biopsychosocial examination, I'm going to go to the next slide, is basically an adult survey to assess someone's mental well-being. So I want us to go into groups of 2, 3, 4, and whatever you feel most comfortable with, and I want you to assess each other. But I want you to do it one at a time. So one person does, the other person watches, and the other person participates as the patient. Does that make sense? And I want you to be honest as you are, about how you're doing and what brings you into the conversation today. And it's going to last about 20 to 30 minutes, depending on how many people are in your group. But the purpose of this is not to give you a medical exam. It's to nurture understanding of what a mental health professional looks for to help someone understand their own mental well-being. So, does anyone have questions before we dive in? So there has to be an honest conversation in order to give you the best treatment. But 1 through 5 is just assessing for the presenting issue of a person. The reason why we ask, why are you here today, is because we just want to get to the meat of it. Tell me why you're here. And then 6 through 13 are the risk behaviors associated to suicide. When you're not eating, when you're feeling hopeless, when you're not motivated, when you're suspicious of other people, you tend to isolate. And so those are higher risks of suicide. Sleep is also a really big deal. And then you move into substance use. When it comes to substance use, we always like to assess for immediate risk. So if someone is using substances, they're considered higher risk because they can do immediate danger to themselves or to others. And then personal, family, and relationships are important to assess because those are what's called protective factors. Protective factors actually help keep you alive. They give you a reason to live. So when it comes to suicidality, someone who has meaning in their lives are more likely to not complete suicide. Make sense? Okay. And then when it comes to education, those are also a protective factor. When someone has an education, they're more likely to have positive support systems. When someone's gang involved, they're less likely to get out of the situation because their education level doesn't allow them the opportunity to leave the gang environment. So we also assess for work, medical, and legal because, again, risks involved with treating a client. Does this person need resources? What's called wraparound services. So we ask all of these questions for child, youth, and other adults because we want to see, does this person need any other resources outside of just mental health treatment? Maybe you're a single mom who is taking care of her 3 kids. Maybe you need childcare. Maybe you need housing. Maybe you also need rehab. So that's why we ask all of these questions. How was the assessment for everybody? Oh, you said boring. That's good. That's a good sign, though. I know this one doesn't have spiritual, but that's also one of the things I wanted to cover because one of the things, it's good for resources, but it also helps extend lifespan. So they found that people with religious backgrounds tend to live 12 years longer than the average person. The reason for that is because of rest practices involved with religion. Rest. So Jewish populations, Jewish Christians and Catholics who practice Sabbath, fasting, prayer, all of those things have been told to actually extend lifespan because fasting actually cleanses your digestive system, as you know. Sabbath reduces your stress load, so being able to take one day out of the week, if you actually added up your entire life totality, that's 12 years that you're taking off. So you end up living that much longer. So, yeah, so Sabbath, fasting, prayer, community is also involved with religion. So, yeah.
Being a member of organization, right?
Yes, being part of like y'all. Did anyone learn anything new about their partner that they were interviewing? Anything surprising that came out of the conversation? You don't have to share what you talked about, but maybe anything that surprised you about how the conversation went. Yes.
But you don't want me to.
If with permission.
It was surprising to me that it was just surprising to me.
So when it comes to depression, it has to go for 2 weeks or longer, the symptoms. So it has to be persistent.
So if it's longer, that's when it becomes
a problem. The reason why we ask is, let's say you've had sporadic symptoms for the last 3 years. It's probably more persistent depressive symptoms than major depressive symptoms. Make sense? So what we're assessing for in question 6 is any immediate risk. So is this person at a harm to themselves or others? Do they feel like they don't have any motivation? Do we need to put them in residential treatment, inpatient treatment? Yeah, all of that.